My name's Sister Charity Mukuha. I'm a registered community health nurse working at Bula in St. Joseph Bula Mission Dispensary as a nurse. And I would like to talk about malaria, since it is one of the main conditions that we are seeing in our health facility. Malaria is a parasitic infection which is caused by female Anopheles mosquito. The signs and symptoms of malaria are headache, joint pains, general body malaise, sometimes even the abdominal pains. Diarrhea can also be a sign and symptoms, backache, joint pains. So those are the main causes of, the main signs and symptoms of malaria. The management for malaria, we usually use the L, that is coartem, but this depends with the age of the patients, whereby we just give from 5 kilograms and up. So for the children who are 5 kilograms up to 14 kilograms, we give 1 tablet 2 times a day for 3 days. For those who are 15 kilograms to 24 kilograms, we give 2 tablets 2 times a day for 3 days. Those who are 25 kilograms to 34 kilograms, we give 3 tablets 2 times a day for 3 days. And those who are above 35 kilograms, we give 4 tablets 2 times a day for 3 days. You get that sometimes these tablets are resistant. So when a patient comes and you get that you had given tablets, coartem or AL, and the patient is not responding with the drug, we usually have other medication. So for now, we are giving tablets dual protecting for those patients who will be able to swallow the drugs, because you get sometimes the patient come with vomiting and they cannot swallow, since vomiting is also one of the signs and symptoms of malaria. So you get that those who cannot swallow, we give injection quinine.
Every day?
Not every day. Injection quinine, we can give it in drip form, whereby there are 3 doses. For the adults, we give 600 milligrams. We put it in 5% dextrose, 500 mils, and then it lands slowly for 4 to 6 hours. And then we give 3 doses. That is for those patients who have resisted to that tablet. All those who cannot swallow because of severe vomiting, because of the malaria.
Right.
But for children, we give as per the kilogram body weight. That is those children who are below 12 kilograms, not 12 kilograms, sorry. For those children who are below 12 years of age, we give as per the kilogram body weight.
Right.
In drip if they are vomiting. But if they are able to swallow, we can give quinine tablets. Also for the adults, for those who are able to swallow, we can also give quinine tablets. Also, we usually get pregnant mothers who have malaria. For those who have malaria, pregnant mothers, they are supposed to use quinine tablets, all quinine injection. Since up to now, they have not confirmed whether the tablet coartem can be used in pregnant mothers. So you give 600 milligrams tablet 3 times a day for 7 days, that is 1 week.
Wow.
For those who have severe malaria, we give quinine in drip. That is 600 milligrams. You put it in 5% dextrose, 500 mils, and then it lasts 4 to 6 hours. That is for 3 doses. Yes.
So is there anything people can do to prevent getting malaria?
Yeah, the prevention of malaria, there's something that we can do. we usually advise people to clean the surrounding, since if it is very bushy, the drainage is not good, there is a lot of mosquito breeding there. Also, we usually advise them to use mosquito net, to sleep under the mosquito net at night. Since mosquitoes, they usually get in, and then when they sleep, they just bite. Also, we advise them to put nets in their windows and close their windows during the day, so that in the evening, during the day, the mosquito cannot get in the houses.
That's good.
There are also complications of malaria. So if this patient is not well managed, or the malaria is very severe, it's become resistant to the coartem, to the quinine, to the deocortexin, this patient can complicate malaria and get chronic malaria, whereby it is very chronic, that it is hard for that patient to be treated.
Right.
And later it can cause cerebral malaria.
Oh.
Yes. So cerebral malaria, the patient is usually confused like a psychiatric patient.
Right.
Yeah. But later this patient can be treated, but with those high drugs.
Right.
Yes.
Do they have to be hospitalized?
Yeah, they have to be hospitalized when they have cerebral malaria.
Okay.
Even when these patients have, you are giving the quinine drip, they are hospitalized so that you can monitor the patient.
Right.
As the drips goes on, not at home. But the tablets, they are given and then they are discharged to go home.
Sure.
Yes.
How many patients do you see, like every day do you see a case of malaria?
In a day, out of allowed 30 to 40 patients that I see for malaria, allowed 15 to 20 is malaria cases.
So if you see 40 patients a day, about half of them are malaria patients.
Half of them is malaria. Other patients, when you send them to the laboratory for the confirmation, if that patient had taken any other medicine, the blood side in the laboratory will not show the malaria parasite. But because the drug interfere with the blood, but since the patient is coming with the presentation of malaria, that is headache, joint pain, vomiting, general body malaise, we usually give them the treatment for malaria.
So do you do a follow-up study with blood work to confirm they have malaria, or you just treat the symptoms?
No, we do confirmation of the blood from the laboratory.
So when they do a blood specimen, are they looking for the plasmodium? What do they see in the blood?
They see the malaria parasites.
Yes.
Yes.
Okay.
The plasmodium.
The plasmodium.
Yes.
Okay. Great. Thank you, sister.
Thank you too.
Here is the medication Sister was talking about. Again, this is the name of the medication. It gives you some background.